Continuing Mobile Education for Emergency Medical Services Providers. Episode 1, What Are You Taking? The Complete Pharmaceutical History. At the end of this episode, you will be informed that older adults usually take multiple medications. You will understand the importance of pre-hospital pharmaceutical histories, and you will learn the components of a complete pharmaceutical history.
The majority of older adults are on multiple medications, and this is what we talk about when we use the term polypharmacy, is that there's many medications. And the concern with that is that as number of medications increase for a patient, the potential for drug interactions or side effects from those medications begin to accumulate. And certainly many patients have some bad side effects from these medications. But we also have to think about the fact that older adults are taking multiple medications. They have to remember to take that and have a strategy to take different pills during the day, different frequencies during the day, and so that for the chance of medication error or even forgetting those medications become a significant concern as well. Polypharmacy is something that we certainly are concerned about in geriatric medicine, and it's, I think, a significant contributor to many of the things that we think about with geriatric patients, increasing the risk for falls, precipitating things like delirium, and also just having the side effects that we're concerned about based on the individual medications. But it's not uncommon that older adults are on these number of medications because of the multiple chronic conditions that they're being treated for. It doesn't take much in terms of some cardiovascular conditions, hypertension, some diabetes, to be on multiple medications. And we're certainly concerned about that in the nursing home, where we use kind of a standard that 9 or more medications is really at least a word of warning to us to evaluate whether or not that these are appropriate in terms of those being prescribed to the patients.
If you look at some of the data out there, elderly 65 and up, at least 90% of people greater than 65 take one medication. But on the average, it's 5 medications per day plus 2 over-the-counter meds. And I think the last numbers I looked at were about 12 to 15% of patients greater than 65 take at least 10 medications or more per day.
Polypharmacy is defined as the simultaneous use of many medications.
So the older we live, the more diseases we see expressed. What was it, 50 years ago, the average life expectancy was 60, now it's 77. So we're seeing a lot more Alzheimer's, we're seeing more dementia, we're seeing more cardiovascular disease, and it's just nature of the beast that the older we get, the more that we have going on. I think other reasons are doctor shopping. I go to see you as a physician, and I don't really care for what you say, but I'm still going to take the meds that you give me. We have pill sharing. It's something I see all the time where a significant other's not feeling that great, but their spouse is feeling tip-top shape, so they'll take their spouse's meds in addition to their own meds.
A good medication history is vital, and there's a couple of different reasons for that. Number one, that medication history may affect your care dramatically, particularly when you start getting into allergies to certain medications as well. Number two is that you are in a very, very unique position being in their home to get the most accurate medication history, particularly when it comes to compliance and medication adverse events or taking the wrong medications. For if I go to a house and I see on the kitchen counter that there are 40 or 50 different bottles, many of which with different expiration dates, I now have a high suspicion that it's very possible that this person might have taken the wrong one, because I'm certainly confused looking at how many pill bottles that are on there. If I then relate that to the emergency department staff, that's tremendous information that the emergency physician can use later on. So again, it's vital. It also helps increase your level of awareness for certain pathologies, so certain medical conditions that you should be looking out for. For example, diabetes. Geez, if they're on a diabetic medication and they're acting a little odd, then all of a sudden diabetes or hypoglycemia has gotten much higher in my differential. Similarly, trauma, if they've fallen down from even a standing position, but they're on warfarin or Coumadin or any other anticoagulant, again, my suspicion for significant injury has just gone up dramatically. So I want to prepare for that and manage accordingly.
Medication history affects care, especially allergies. EMS is in a unique position to get an accurate history, and it may increase the awareness for pathological issues.
We had a really good case. It was a mid-40-ish male presented. He was at work, appeared to have what was a massive tonic-clonic seizure. When he came to, he was kind of post-ictal. He was hyperreflexic. He had weird paresthesias he couldn't describe. And the only history he had gotten to EMS was that he had some reflux and he was taking some over-the-counter antacids. When he got to the ED, the full $1 million tox workup was started. He was a mechanic in a garage, so there was thought that he was exposed to something volatile in nature. And it turns out some Tums were 3 500-count bottles per day of Tums and 3 full sticks of Rolaids per day. So had we gotten a little bit more history, it would have definitely prevented the extensive workup that he received. Needless to say, his calcium was something like 15, his magnesium was something around 4. But it was a big delay in getting the labs that we could have used right off the bat.
I think in terms of the EMS personnel, to obtain the most complete pharmaceutical or medication list is really asking the patient, the family members, the caregivers that are present there, to be able to collect any and all medications that the patient potentially could be taking. Oftentimes, particularly older patients won't think about some of their even things like dietary supplements or herbal supplements as medications they're taking, yet there may be really daily use of these medications. They may not think about medications that are being prescribed by multiple providers as separate types of medications. So oftentimes it's really just being able to consolidate these medications, the pill bottles that are there in the household, and to be able to ask that patient or the caregivers or those that are present about any other additional medications or things that the patient could be taking at that point in time, whether they be over-the-counter medications or those that are prescribed.
Components are going to be any medications that you take, and you'll definitely get a list. Do you take anything over the counter? And I think that list will grow a little bit. And last but not least, do you take any herbal medications or supplements? And I think by asking all 3 of those aspects, you should be able to get a full medication history.
To get a full medication history, ask all the resources available, ask about supplements and over-the-counter medications, and be sure to ask about multiple prescribers.
So when the patient doesn't know their medications, which seems like it happens more times than not, I think there's a few things that we all rely on. One is finding out what their medical history is. And if we're able to ascertain that they have a history of asthma, then it becomes logical to ask, hey, are you on albuterol? Are you on home oxygen? Are you taking Singulair or these types of medications? Same thing for heart disease, same things for hypertension. Do you take a pill for your blood pressure? That helps identify that. The other things that we're more familiar with, checking for vials of life or files of life that are on the refrigerator or in the refrigerator, any type of medication list that is available if it's at a facility, asking for those reference lists, the nursing cardex and so forth are other valuable resources that you can certainly use.
To improve your medication list, use the medical history to ask about specific drugs. Look for medication lists such as in the vial of life, and if available, ask other care providers or family members. After this episode, you will know that older adults usually take more than one medication, and you'll understand the importance of the pre-hospital pharmaceutical history. You'll also understand the components that construct the complete pharmaceutical history.